So integrated care systems bring together all of our different groups, NHS professionals, including GPs who are right at the heart of the NHS service, but also community organisations, service users, community leaders and faith groups. And together, those organisations can make a real difference, and we can land better mental health services, but also better mental health in our communities for all of our people.
Most of mental health care actually happens in the community, whether that's in the workplace, in schools, in community centres, in faith centres, in primary care. So not thinking or not addressing the community is really, you're missing a big part of people's lives.
I'm absolutely delighted to be here today to really have a really deep cross-boundary conversation about why mental health matters, what's important to South West Londoners and how we can really optimise their outcomes, experience and access to a whole spectrum of mental health services.
Came here, I think, first for networking, meeting with colleagues from basically South London, understanding what is happening out there, meeting with community colleagues as well. I think it's important understanding and hearing about innovation, where it's happening in sort of different parts and what we can take away. But I was also a speaker today. I presented under the challenging inequalities in Croydon, and I spoke about the exciting work that we're undertaking in terms of improving our service delivery for people today.
Community is important because of the access to the people. I feel like community is about how we share each other, how we share knowledge, how we connect each other to kind of get the best for the people. So it's important because that's where people are.
I think there is a incredible work being done by the NHS and various systems in the UK and in the borough, but that is going to be upheld and sort of holistically supported by the community, and this is why I talk about partnerships and collaboration, because there's going to be sometimes we can be helping the same people and not even realize it, or we can have strengths and weaknesses where others don't realize we have them, and if we come together we can then be able to support not just a small minority of people who are on the extreme side of things, but anyone who needs support at any point.
So today at the conference I've been participating in some of the activities and just getting a little bit more information on some of the things I wasn't sort of like aware of, like for example found out about the Jigsaw initiative, which I really feel is going to be helpful for some of the clients that we support. So it's been helpful just to listen and get a bit more information with what's going on with the other organisations around.
Because there's a lot of people out there who need help, and a lot of people are misguided, and I think it's good that the community works together to promote and to show these charities that are actually here to help people regarding mental health and different types of things.
National and local suicide prevention strategy that Hold the Hope helped to draft has a key objective, which is making suicide prevention everyone's business. And how do we do that? Well, we have a project that goes out across the community, and suicide prevention has got to be where everyone raises awareness about suicide together, and that's the way we will save lives. If we stand together, smash the stigma, and in solidarity and compassion with each other, that's the role that community can have in saving lives.
Part of our strategy is that mental health issues are not just addressed in clinics in mental health settings, but they're addressed in workplaces, in education, in GPs' offices, in churches. Churches and faith groups are really great opportunity for people to identify those who are struggling and to reach out and support. And if we all work together, that power of working together and connecting actually creates huge opportunities to help people.
I think the communities are an essential part of our work. Well, when I think about our organisation, we provide over 40,000 treatments to 40,000 people in the community, and our communities and our community leaders are the best placed people to know what's best for them in terms of the prevention of mental illness, in terms of how they can access services more effectively and how we can provide better outcomes for the whole population. So I think they're a key partner, indeed essential, that we're able to hear and listen to them about how best we can fill gaps in the things that we currently provide.
Right now, a lot of stigma is present in our communities, in South Asian communities and Black communities related to mental health, and I think it's our job, because they're our community members, and it's very culturally important for them to have someone who knows what their culture is, what impact culture has on them. And I think as a person of color, I can understand maybe a South Asian person better, and I think that's why community is important. And I feel communities care, communities culture, and community is important.
Community is everything to the work that we do. We're generally, as an organisation, Jigsaw for Your Staff are local people themselves. We're from the communities we represent. We have lived experience of the services that we deliver, and that gives us that authenticity with the beneficiaries that come to us for support with whatever they're experiencing at the moment. And we combine that lived experience and local knowledge with professional approaches around mental health to help people get through what they're experiencing.
Communities are so important across the whole spectrum, because they're everything. You take away the layers of NHS and care and stuff like that, all you've got left is community. In whatever vein that is, it is the essence of everybody, and it's the building blocks of everything that we need, I think. So communities, without them we'd all crumble, so they're fundamentally important to everyday life, I think.
So the second mental health conference was all about bringing our communities together, and I just think we've just really shone today. It's been fabulous having our lived experience voices throughout today, our community, third voluntary sector, how strong the work was, and then all linked together with that real commitment to making a difference for people with mental health conditions across South West London. So thank you to everybody who participated, and I'm looking forward already to what we're going to deliver in this third year, and our conference next year will go from strength to strength, because we're a really strong community. Thank you all.